Dan Moskal here, and we are talking to my mom today, Jolie Moskal. She's a mental health therapist, but don't construe this. This is not this is not healthcare advice. Go and see and talk with your own doctor. So, a few years ago, I'm 29 now. A few years ago, I was diagnosed and have been using ADD and ADD medication, and it has made what I feel like all the world of a difference in my life. Before 30, I've had a national television commercial. I've got a bunch of books written. I believe it's only through the assistance and with the help of kind of getting this figured out. Before I kind of get into the backstory, let's talk to you, Mom. Walk us through your experience.
Well, Daniel went back to college, and at, what were you, 27, something like that, 26?
Yes, 26.
26, I don't know. But anyway, he was experiencing lots of anxiety. He would worry and worry and worry about tests, and even if he had a 98 going into a test, afraid he was going to flunk the course, and it just didn't make sense to me that he was having so much anxiety. Then along came one of my clients, a girl who had just been to a psychiatrist and had a lot of anxiety, and she had been diagnosed as ADD. And all of a sudden I started putting two and two together and thought that maybe we should have Daniel evaluated to see if maybe he also was ADD. So took him to my family physician, and we put him on Adderall, and it was night and day for him. It made a huge difference.
What was the difference that you saw?
Not so much anxiety. Wasn't so worried about things. Kind of calmed down. Was able to focus.
What do you think some of the symptoms of my ADD were?
Mostly I saw the anxiety. I saw this just almost obsessive-compulsive worrying about different things. Brain would go around and around and around in circles and not be able to focus.
I think that's very accurate.
Yeah.
So what are some of the benefits you've seen since I've been?
I think he's happier. I think he's more content with life. I think life isn't quite so hard, so difficult to manage.
Any side effects or drawbacks to it?
Not that I personally see. I don't know. I think financially it's a little bit of a drawback to have to pay for medication, but no, not really. I don't know of any side effects at this point.
Would you say anything to anybody that's listening that thinks they may or may not have it?
If you have a lot of anxiety, if you just can't seem to focus on certain things, if you have trouble with processing information, I think it would be worth talking to your family physician. And sometimes even just getting on the internet and looking at the symptoms of ADD. And the way that you could conclusively tell is people on ADD medication, it's my understanding, within 24 hours it makes a big difference in their life.
I totally agree. We saw a huge difference almost overnight.
Right, within hours.
And can you tell them how I responded to your suggestion of a stimulant to alleviate my anxiety?
You weren't too thrilled with my idea, but you were willing at least to talk it over with the physician.
Out of desperation. Out of sheer desperation. I'd gone back to school and I made the dean's list, 4.0, every single semester, finished school. I think I had 1 B over those 2 years in Spanish class.
Yes.
I bet you know better than I do.
Yes, Spanish is not your strong suit.
So don't construe this. This isn't medical. This isn't medical diagnosis for you. Please see a doctor. But this is just a glimpse into a mom's life with an adult kid with ADD. And one thing to clarify, I did have one of the causes that we believe. Well, why don't you share, Mom?
Daniel, at age 10, had a brain aneurysm, which is major trauma to the brain, and that, as I understand it, is one of the causes of ADD.
They say genetics could be another cause, but I'll let you guys figure out what your cause is if you do have it. So, anything else you'd like to say about it?
I think it was that you had tried everything to try to alleviate the anxiety, including exercise and getting off caffeine and just all sorts of things, different kinds of medication, and nothing began to alleviate the anxiety and the obsessive thinking. So it seems like that, at least for Daniel, for us, was a big indicator that there needed to be something different happening.